Hamilton experienced 97 code zeros last year. This is a terrifying event that means there are absolutely no ambulances available to respond to an emergency call. And this is a direct result of overcrowded and underfunded hospitals. Last year, paramedics spent 32,000 hours waiting to drop off patients at backed-up emergency wards, and the problem continues to grow. Hamilton's mayor stated it's a vexing problem, but one that rests with the province. The Ontario government needs to address the associated problem of hallway medicine in hospitals. Through you, Speaker, will the Premier commit to addressing the root cause of code zeros in Hamilton and end the continued underfunding of our hospitals?
Minister of Health.
Thank you very much. Well, there's several issues that the member has raised with her question. One is the issue of ambulance delays. There are several places in Ontario that are experiencing that, and that's why we are committed to strengthening the dedicated offload nurses program to help improve ambulance offload times in emergency patient care. We've invested $16 million to 20 municipalities to help ambulance be able to return to the community faster and to be able to respond to more emergency calls. This funding is expected to support more than 164 equivalent nursing positions in 49 hospitals, while increasing ambulance availability by 449,000 hours. That represents a return on investment of more than 51 ambulances available to respond to 911 calls. So we are continuing to respond to that. I will respond to the issue with respect to hospital funding in my supplementary.
The supplementary question.
Speaker, back to the Premier. I mean, this problem in Hamilton continues to grow, and it's a crisis. And you know what the government's most recent suggestion was? Was batching. That paramedics should double the number of patients that they're caring for in emergency rooms. It's deplorable. And this is an insult to paramedics who are already working beyond capacity. I spoke to the president of Hamilton's Paramedics Union. Hamilton paramedics want this government to know that the solution to hospital underfunding cannot be solved by asking paramedics and other frontline staff to do more with less. So again, through you, Mr. Speaker, I ask the Premier, knowing that inaction will cost lives, will you commit today to reversing the underfunding of our hospitals?